Okay, everybody, we have reached the bottom of the hour, so let's get started with today's L10 webinar, Navigating Value-Based Selling to Improve Market Share, sponsored by CMR Institute. My name is Tim Sosby. I'm Editorial Director for L10. It's my pleasure to welcome you today and to serve as the host of our program. I'm going to start with some quick housekeeping items, including, most importantly, how you can participate in today's webinar. We are planning a 60-minute session for you. You'll notice that your phones have been placed on mute, so any questions you might have throughout today's webinar, please submit them using the questions window or module there on the control panel on the right side of your screen. You can just type in the questions, hit the submit button, and we'll ask them promptly or queue them up for the Q&A toward the end of the hour. I always recommend please do submit your questions while they occur, while they're fresh in your mind, and we will get to them as quickly as we can. I also wanted to point out in that control panel, there's a handouts window. There's several items in there that you may wish to download for later reference, including a copy of today's presentation slides and some information on some the L10 conference and some other L10 programs. You can grab any or all of these, just highlight the titles, and the system will walk you through how to download them to your desktop. Today's webinar is being recorded and will be archived for on-demand access through the L10 website. We're going to send you a follow-up email about 1 hour after today's webinar ends with a direct link to that webinar recording, but it'll also be available a little sooner than that on the l-10.org website in the on-demand webinar archive. Speaking of following up, as you leave today's webinar, a short survey is going to pop up on a separate browser window. Please do take a moment as you leave today's webinar, look for that survey, and quickly share your thoughts with us. We produce these programs for you, so of course your feedback is always appreciated. And along those lines, my email address is showing here on the screen. I'll share it again later in today's program. If I can help you with anything around our webinars or anything around your L10 membership, certainly don't hesitate to reach out. And okay, with all of that said, I'm going to go ahead and turn things over to our moderator today, Laura Ramos-Hegwar. Laura's going to take over from here, tell you more about our speakers, and get the program started. Laura, thanks for joining us.
Thanks, Tim. I'd like to go ahead and welcome our panel today. So first, I'd like to introduce Greg Adamson, Senior Director of Sales Training and Enablement at Philips North America. Greg has extensive expertise in sales, sales management, and sales training in the hospital market. He's also a vice president at L10. Greg, thank you for being a part of this panel today.
Thank you.
Next, I'd like to welcome Mila Maloney, vice president of strategic supplier engagement at Premier Incorporated. Prior to joining Premier, she spent 16 years at Merck in a variety of roles, including sales leadership, strategy development, and global learning and development. She also served as a Merck Fellow for Global Health in Washington, D.C. and Tanzania. Mila, thank you for joining us today.
It's my pleasure. Really glad to be here.
Next, I'd like to introduce Alistair Barrow, a value-based healthcare consultant with CMR Institute. Alistair has held multiple leadership roles at Boston Scientific and J&J, where he was the worldwide learning and development manager. He is also an instructor in CMR's value-based training platform. Alistair, thanks for joining us.
It's a pleasure. Thanks for having me.
And I'm Laura Hegwar, a healthcare writer and editor with Vital Communications. For many years, I was editor of L10's Focus. Today, I write for several industry publications and host CMR Institute's iBrief podcast series. So let's go over what we hope to accomplish today. Our first objective is to identify opportunities for win-win partnerships between industry and providers. Our second objective is to determine the key elements that must be present to create a winning value proposition for key influencers and decision makers. And then our last objective is to describe proven methods and resources that can help you meet the changing needs of customers and increase sales. So before we get started, let's see who's in our audience today. Please tell us who you are. Pick A if you are a director of training or a training manager. Please pick B if you are a market access or managed markets trainer. Pick C if you are an account executive. Pick D if you are a sales representative or a manager. And then pick E if you are if your role is actually not listed here. Go ahead and make your selection and then we'll get started. So Tim, who do we have in the audience today?
Laura, we've got a great audience. It looks like almost everybody has voted. I'm going to go ahead and close the poll here. If you haven't voted, make your choice here very quickly, please. Thank you. Let me go ahead and close that off. And Laura, here's who we're meeting with today.
Okay, great. So I think that's helpful for our panelists to know about the audience. I'd like to start out. Let's move on to the next slide. And why don't we take some time to explain the concept of value-based payment. Now, value-based payment models reward physicians, hospitals, and so forth based on the quality of care they provide, unlike traditional payment models, which reward providers for the number of services they perform. So where is the industry at when it comes to adoption of value-based payment models? There was an interesting study that was just published by the Healthcare Financial Management Association that found that the number of providers engaged in value-based payment arrangements with commercial plans has actually doubled in 2 years. The study also found that nearly 3/4 of executives say that they have achieved positive financial results from value-based payment, and that's up from just half of executives 2 years ago. So given that more providers are moving toward value-based payment, I'd like to ask the audience a quick question. Are value-based payment models a threat or an opportunity for a company that wants to grow its market share? So please pick A if you think value-based payment models are definitely a threat to market share. Please pick B if you believe value-based payment models are definitely an opportunity to grow market share. Please pick C if you think these models could be both. And pick D if you really aren't sure about the impact. Go ahead and make your selection now. Tim, so what does the audience have to say?
Well, thank you, Laura. Everybody's voting very quickly. We appreciate your interaction on this. You can just wrap up your choices here in the next couple of seconds. I will go ahead and close the poll, and we'll look at the results. Great, everybody. Thanks so much for sharing with us. We appreciate that. Let me close the poll down at this point. And Laura, here's what the room said.
Okay, could be both. Well, that's interesting. All right, so let's talk about that. Let's go ahead and move on to our next slide, and let's see what our panelists think. So, Greg, first, why might value-based payment models be a threat to the industry?
Well, the big thing, Laura, is this is not how sales reps are incented. When sales reps aren't given a quota on the number of solutions they provide or how they decreased the spending or the operation efficiency of a hospital. Instead, they are incented on how many dollars did you sell. When you have a national sales meeting, no one gets up there and says, here's how many solutions we provided or how we helped a certain number of hospitals with their value purchasing numbers or score. So what happens is we send conflicting pieces of information. We get up there and say, this is how much market share we gained on the other competitor. And we're talking about how many products do we sell for how many dollars, and we're looking for market share. And that even rolls lower right into the stock price. Is that if you miss an earnings in a quarter, the whole company takes a major hit, and they're not lined up with that. They're still lined up in a fee for service. How many dollars did you sell? Not how efficient or how many partnerships did you build.
That's a good point, Greg. What about the opportunities for value-based payment models? You know, we had 64% of the audience say that it could be both. So what about opportunities?
Well, I do think it's an opportunity. It's since I'm with one of the, I guess you'd call the 10 or 20 big medical device companies, it's easy for me to say that we have all types of solutions. Our new line is we don't sell products, we sell solutions. Don't sell boxes, we sell solutions. So it gives us a great chance for partnership. I think if you're a medical device, the one thing in common that drives us all crazy is we have bids go out and all that kind of stuff, and the customer tells us, yeah, we want to have a partnership, but really it's whoever has the lower price. So it's a race to the bottom on price. When we're thinking now with this whole value-based purchasing, this could be a chance to truly have a partnership where it's win-win and not who can offer the lowest price.
Thanks, Greg. Let me follow up with Mila, get the provider perspective on that. What do you see as in terms of threats and opportunities from value-based payment? Mila?
Yeah, absolutely. So because Premier represents 3,900 hospitals and 150,000 other provider organizations, we certainly have the ability to get a lot of perspectives and points of view. And one of the things that we continually find when we hear from anybody about value-based purchasing is that it seems to equate in their mind lower cost. And quite frankly, it sometimes could mean higher cost. If you would presume that newer technologies and newer devices and newer pharmaceutical products bring with them the increased ability to improve quality, then theoretically, value-based payments might actually mean higher cost. But, if you look at what's on the slide, and even as it was being described from an industry perspective, people tend to go towards that lower cost. We hear the same thing from our providers. When they are thinking about value-based purchasing, they're thinking, how can I save money and cut costs? So what we're trying to do is to help change that perspective so that they understand that this is really about the total cost of care versus just what you're paying up front. But until we really shift that paradigm of thought, it's going to be hard to progress value-based contracting and value-based purchasing in its true meaning.
Mila, thank you. That was an excellent summation. Alistair, what about you? Any thoughts on threats and opportunities that you wanted to add?
Yeah, I couldn't agree more with Greg in terms of the threats, being that the companies are not necessarily set up from an internal perspective, from commercial operations to sales to marketing, really to speak to a value-based system. And instead, what we do is we ask the reps to go and do something outside of their normal scope of influence and outside of their expertise, and it runs us into problems. Expounding a little bit on Milo's point, though, in terms of the opportunities, it really depends on what the company's long-term growth strategy is and what they want to be when they grow up. So, i.e., are they a commodity company? Do they have commodity products? Are their products really revolutionary and quality products? Or is it a mixed bag? And then they have to be really adept at segmenting their portfolio to speak to that particular area of the market that they represent. And put together a new go-to-market strategy. Providers are challenged with maximizing their percent of Medicare dollars, right? Which is what they're being rewarded for hitting quality gates. So once your company understands what those payment requirements are, you only need to ask yourself if your company can provide or help the providers achieve the success that they're looking for while using your products and services. So that's really the focus. And the question at the end of the day for most companies is, what's your proof? Because you have to remember that our providers are not only looking for claims, but they're looking for proof so that they can report that to maximize their reimbursement.
Alistair, thank you. That was very helpful. It sounds like there's a lot on the line for both providers and the industry. So given that value-based payment models are emerging, I'd like to ask our panelists about their thoughts on value-based selling, an approach to help mitigate the threats and maximize the opportunities from value-based payment models that our panelists just mentioned. So in essence, value-based selling matches your selling strategy to the customer's buying strategy. Alistair, can you talk about this?
Yeah, when I speak to providers, and I have the opportunity to do that on a daily basis, folks like Mila, when you ask them about their new buying strategy and value-based purchasing, what they say is really important to listen closely to give you clues into how to sell to them, so to line up your selling strategy with that new buying strategy. So, for instance, value-based payments, it really rewards for quality measurements. For the sales force, you need to know what those quality measurements are and how, what is the percent of that particular reward for your provider. They also pay on efficiency models or efficiency of care. So from, a patient coming into the ED to discharge and then on to post-acute care, what does that look like? And how does my product or service match up? So doing that particular needs analysis. Physician value-based modifiers are a big deal as well, because it really switches your physician from getting paid on a fee-for-service basis to more of a value basis. So really 90% or more of their payment is now wrapped up in quality metrics, efficiency models, and patient experience. And how does your product match up to that? And then finally, reduction programs are out there. We all see that, right? The reimbursement reduction or hospital-acquired infection reduction programs. How can you help with those kinds of things? Because really that's what they're focused on, because that's how they're getting reimbursed today.
Alistair, thank you, especially for mentioning the quality metrics. I know that many provider organizations are tracking more than 100 different metrics just to make sure that they're transitioning properly to value-based selling or value-based payment. So Mila, can you give us maybe your take on the provider's perspective for value-based selling?
Yeah, so, unfortunately, we don't have any providers that are all sitting on a webinar right now figuring out how to work well with industry. I don't think they even realize how lucky they are that there are a group of individuals across all of these different manufacturers trying to figure out how to bring value to them and help them meet their goals. So the reason I set that context is, if you think about it, everybody's sitting around prior to going in and meeting with this healthcare system and thinking about, how can I do a needs analysis, or how can I identify common goals? But that's not what they're really expecting from you when you come in. That's different. That's unique. They're probably expecting the old typical feature and benefit conversation. And I know I'm speaking in generalities, but that's still a lot of times what they're expecting. So if you go in and ask questions in a different way, they may not be prepared to answer them because they weren't expecting that. And so what I would recommend is really setting the context, if you can, ahead of time, to let them know that you really want to help them meet their cost and quality goals, that you understand the challenges that they're facing, and that when you come in, you want to be prepared to have that kind of higher level conversation. Because if you don't, you really may not get what you're looking for out of the discussion. If I think back to my industry days, I remember a time when we launched a new selling model, and they wanted us to go in and ask questions about what could we do differently? How could we bring more value? And what we got back were things like, we could use more samples or more healthy foods at lunch, because that's the context in which they thought of what we could bring to them. We didn't really set the stage for, we want to do things differently. We want you to view us as differently. We want to bring more solutions. And so I think it's important for providers to understand that when you walk in the door, that you're trying to do something different.
Mila, that's a great point about the need to really prepare providers to have a different level conversation than what they're used to. So Mila, let's move on to the next slide. I was hoping maybe you could talk about some of the customer issues that value-based selling can help address.
The good news is that they're all up there. The bad news is that they're all up there, and that's really a lot. So while it looks like these, 6 pithy statements, if you dig into what each of those are, each one of those alone is an enormous challenge for the healthcare system to try to tackle. And sometimes they're not even in complete synergy with each other. It's almost contradictory to do one versus another. So if you think, for instance, about patient satisfaction versus quality improvement, sometimes in order to improve quality, you may be doing something that the patient doesn't understand or doesn't appreciate. And the same could hold true for cost containment. So this list is 6 of the things. There's at least a dozen more, as we've already been talking about during this webinar, and it's a lot for them to try to tackle. I think that they're also very nervous to take on perceived risk because of any of these. So as different industry partners come in and present a new way to do things, although from your perspective, you know that you're addressing perhaps even all 6 of these, in their minds, they're worried, am I at risk for one of these to get worse if I try them? So I think it's great that everybody considers these items as well as others that these healthcare systems are trying to tackle when they come in, but it's also helping them understand that you're actually helping them reduce risk versus encouraging to take on more, which might be their perception.
Thanks, Mila. Alistair, wanted to get your take on what Mila just said about the customer issues that value-based selling can help address.
Yeah, I'll tell you what, all excellent points that Mila just made, because as a vendor, we don't typically think about it that way. But it's good to know that the providers are looking for us to help them with this, and we can notify them that we can help them. I think from a vendor's perspective, we are extremely adept at the kind of research that helps us understand the provider and the patient. So these 6 points and others, we're really good at getting at. We just don't normally sell this way. Usually we use the information for internal sort of as an internal guide for our commercialization strategy. Well, we really have to turn it around and start selling in this way. Vendors are getting better at like health economics and outcomes reimbursement information, ROI metrics, population health management information that they can share with the provider to help them with this particular area. And it helps impact, procedural efficiency, procedural success, maximize reimbursement. So really, if we look at this list, and as Mila mentioned, others, it's a really long list. Depending upon what your provider is working on, you have to think from a corporate perspective on how you can help them with this. Again, it's not the way we normally look at this information. We normally do it for internal strategy and commercialization process, but we really have to start using that as a selling tool.
Great, thanks, Alistair. All right, so I'd like to follow up with Greg to get his views on how organizations can meet the changing needs of customers with value-based selling. Greg, what are some strategies that sales teams in the industry can use to protect their market share?
Well, I was thinking of hearing the great answers by Mila and Alistair earlier there. In the real world, when we use all of our approvals and have to go past all the gatekeepers, in a real hospital, most reps have to enter through the basement, right? And there's someone that's talking about where's your rep track certification and do you have this blood test and all those things. So if you get lucky enough to get past that, you got to know that when it comes to PO time, someone in procurement, materials management, they've usually been given a directive, take X dollars out of expense for certain service lines. And historically, for many, many years, we can go to that point and just begin a PO type process and who can have the lowest price. Then we went through a stage where we started calling on the physicians or the department level, and we get them to influence these folks. But now we're learning it's really more about the C-suite, and I call it the C-1 or C-2 level, especially with IDNs. Because IDNs, boy, just because you have St. Mary's Hospital doesn't mean you have Memorial or St. John's down the street. So Laura, we've had to really, really think about how we sell. And it was one thing to have sales reps that called on procurement on the department level, whether it's radiology, cardiology, whatever. But now we've had to come up with new people. We call it account executives. And I bet everybody has an AE or an ISE or something that gives you the title and the right, so to speak, to go in and have conversations with the C-suite or the service line vice president of an IDN. So we've had to completely rethink about what does our sales force look like. And I know later on we're going to talk about what their training looks like, and I'll save those comments for later on.
All right, thanks, Greg. Mila, did you want to follow up with any thoughts on what Greg just mentioned about that approach?
Yeah, I think one of the things that we just continue to hear more and more about is this whole value-based contracting piece. So it's, who you're targeting and how, but sometimes it's not just the message that's enough. And so, if you say we're going to help you with this parameter and they're not thinking that you can help them with that parameter, they may not believe you because you said it. But if you can actually structure a contract in that way, then it becomes a completely different conversation. And we actually are starting to do a lot of that at Premier with our manufacturers and directly with the providers to say we're committing to X. And if X doesn't happen, we're going to compensate you in a way that is logical based on what X didn't do. And I think that's really helping them because, as I mentioned earlier, there's a lot of perceived risk from the provider's perspective in entering some of these relationships with industry. But if they feel like that this will help mitigate at least the perceived risk, then it's a really big win. And the great news is I see that all of this great outcomes data is out there. So everybody's doing a great job proving that their products do what they said they would do. So it really makes it easy then to contractually into a relationship that is structured in a way that makes the providers in the system more comfortable with this approach.
Thanks, Mila. Alistair, did you want to add anything?
Yeah, just real quickly to both Mila and Greg's point, the most strategic providers out there are the ones that are signing up for both single and double-sided risk agreements. It's important for us to know that and know what they are. And what the expectation is that when their vendors come to them, because they are signing up for risk with their payers, they're hoping that their vendors will also sign up for that same risk so that they mitigate some of that, the downside of having to put out a lot of funds for a particular product or on some sort of integration strategy. That's a big deal. Their expectation is that the vendors will be more engaging in those risk agreements, and that project confidence and quality of those projects will be something that will help them really maximize their reimbursement. So cost, outcomes, claims, really you start to have to put your money where your mouth is. If you make those claims, you really have to prove that point in order to stay a partner with these folks, or you end up getting kicked out, a year later, or sometimes even shorter time frames, in lieu of another vendor who makes the same claim but also has measurements and can prove those claims.
Thanks, Alistair. Okay, why don't we move on then to another question for the audience. One of the themes that I'm getting from what the panelists have been talking about is really about the importance of crafting an effective value proposition. And I'd like to ask another question of the audience. Where do organizations go wrong when it comes to crafting effective value propositions? Pick A if you think it's misunderstanding customer needs. Pick B if you believe it's offering the wrong solutions. Pick C if you think it's targeting the wrong decision makers. And pick D if you believe it's not providing adequate evidence. Go ahead and make your selection now. Tim, what did the audience say?
Thanks, Laura. The votes are coming in. Let's give everybody just a few more seconds to wrap up their choices, and then we'll close off the poll.
Great.
Thank you. We actually have an audience question coming in too. As soon as we're done with this poll, I'm going to go ahead and ask that if you don't mind.
Sure.
And let me close this off. And actually, somebody commented in the questions box that the answer to this question should really be all of the above. Let me go ahead and close that off, and let's look at the results and see what the room said.
Okay, so let's see, we've got 42% saying not providing adequate evidence, 25% saying misunderstanding customer needs, and then in the teens for offering the wrong solutions and targeting the wrong decision makers. So it's pretty split, but with not providing adequate evidence as the lead. So that's interesting. Let's go ahead, and we're going to move on to the next slide. We can maybe talk a little bit about that, and also the particular components of what a value proposition is, especially for customers who are making the transition to value-based payment.
Laura, before we move ahead, I'm sorry, yeah. Laura, before we move ahead, if I could go ahead and jump back to the audience question.
Oh, sure. I'm sorry. I thought that's what it was. Sorry.
No, different one. Question from Laura. She was asking, for the panel, do you see patient satisfaction being replaced by a less subjective measure? Many hospitals struggle with achieving always responses for patients after an inpatient stay.
Mila, do you think you could answer that?
I was getting ready to jump in. It's like you're reading my mind. I think absolutely these subjective measures are really challenging. You're chasing something that is not that tangible. And I'll give a real life example that people are dealing with right now in terms of hospital systems. I think everybody's familiar that we are dealing with an unprecedented opioid epidemic right now. And as we know, for years, there was always that question about what is your perceived pain? And it was considered absolutely unacceptable for anyone to be over about a 1 or a 2, irrespective of the fact that they may have just had their entire knee removed and replaced. For some reason, it was perceived that it would be very negative to have a pain score. So people were throwing pain medicines at these patients to help them ensure that they would not get a bad pain score that could then also equate to a negative patient satisfaction score, which would hit them as a financial penalty. And now they're faced with, well, that's important, but what's more important is ensuring that we help the entire health of our communities. And with that would be strategies around safer pain management that does not include opioid overuse and misuse. And so that's an example of a complete misalignment of what's best from a healthcare perspective versus trying to chase down something that's subjective. So I think as we continue to have these examples, it's raising awareness and changing some of the regulatory and CMS environment so that they understand that sometimes you have to forego some of these more subjective measures to do what's best from a total health perspective.
Isla, thank you. Appreciate that. Okay, so let's move on then to the value proposition piece. And Alistair, maybe now you could talk a little bit about the importance of crafting of the right value proposition as providers are making the transition to value-based payment. Can you talk a little bit about what's involved in a value proposition?
Yeah, having done this quite a few times with a number of companies that I've worked with, it tends to be more focused internally, which is a problem. We need to start focusing our value proposition outwardly and hitting those points that our providers feel are important. So our value propositions are normally focused on two things. One, our feelings about our products and what we say is important about that particular product. And two, features and benefits. So I agree with the audience in terms of the number of folks that don't think we provide adequate evidence. That's a really, really big deal. So in terms of your value proposition, your providers are waiting to hear your company's capabilities, not your product's capabilities, in helping them solve their problems. How do you help us hit these revenue targets? The components really lay out a framework to answer 4 questions for your providers. So all the things you see up there, the time frame, the key target users, the next best alternative, and all the rest, and finally the price at the end, it really answers 4 questions for your providers that they're really hoping to hear from you. What do you do? How do you do it? How do you do it better than your competitors? And by the way, how do you do it better than us? Because we're not just sitting around, we're trying to solve these problems ourselves. So how do you do it better than your competitors and us? And finally, the big deal, what's your proof source? What's your measurement component? Does it involve some sort of IT, some sort of integration, or some way that we can capture this to share not only up and down the organization, but also share it with our quality providers, the folks out there that are looking to get these quality metrics so that they can report them and we can get reimbursed properly. Those are the 4 questions your value proposition really needs to point to.
Alistair, that was great. Thank you so much. Mila, did you want to add any thoughts based on your experience working with pharmaceutical companies and hospitals?
Yeah, I first of all love how you frame that up, Alistair. I think that if every single supplier were to answer those 4 questions, not just to us, but to our member hospital systems, it would probably make partnerships a lot easier, because we can tell the difference between those that come in and really understand the challenges that we and our members are facing versus those that don't. And it doesn't mean we can't work with those that don't. It just means that we have to sometimes pull it along a little bit differently. So when we're thinking about who our strategic partners are going to be, because we have 1,200 suppliers in our mix, and we can't possibly have a strategic relationship with 1,200 suppliers, and neither can our members, it's made up of several things. So part of it is having products that are the right products for our members. So that kind of gives you a seat at the table. But then it's those people that have really figured out the alignment that they can have with us and our members that are at the highest levels and are the most valuable and are best aligned to what problems we're all really trying to solve. So if you were to answer the questions of what do you do, how do you do it better than your competitors, and how you do it better than us, if you came in and said those things and they're aligned to what we're trying to solve, it would be so easy for us to partner. But sometimes it's hard for us to find that alignment, and it's not just the fault of the industry, it's sometimes the fault of us. We're not always as transparent as we might need to be, or we may not always be as available as you need us to be. So sometimes you're out there just trying to think of these things yourself. So I do think it's going to take continued awareness and partnership from both of us for us to really get there in a collaborative way.
Thank you, Mila. So why don't we spend some time then getting the panel's input on some of the specific strategies that organizations can use to meet the changing needs of customers and improve their market share. In particular, I'd like to talk about what companies can do to meet the changing needs of customers as value-based payment models gain more traction. Greg, can you tell us what you're doing to prepare your team?
We've had to go through a pretty abrupt change. I'd like to start off with this, Laura, just so the audience knows when I use this language that there's a sales process, and like the big 3 out there in the world are strategic, solution, and consultative. And then there's like sales conversation, the stuff that for many years, spin, integrity, PSS, et cetera. And I remember our sales training being really, really heavy on just the conversation and not how to manipulate a conversation, but how to get what you want, ask questions. And that never goes out of style, and that's still important. But we've learned there's an increased importance on the process. In other words, I always talk about you pull up to a parking garage of a hospital and your palms are sweaty because you and you alone have to go in there and find out who are the key decision makers, who's on the value analysis committee or new products committee, whatever they're going to call it, who are the decision makers, who are the influencers. So Laura, that's been a whole different piece of the puzzle. We happen to use solution selling in our company, but the other two are very good as well. But we've learned that if we don't train people how to get in there, because you got to, at the end of the day, you got to get a PO. And it's very difficult to do in an individual hospital, and it's really difficult to do in an IDN where there's a whole nother layer or two or three to get to the final decision maker. So we've really had to do that and teach people how do you get to the service line leaders, the people that have vice president in their title, and the C-suite. Easy to say, very hard to knock on that tall glass building in Plano, Texas, and say, hey, Baylor, Scott, and White, here I am. That's a whole different ballgame, and it takes a certain level of expertise and sophistication to get those appointments.
Thank you, Greg. Mila, from your perspective as a former Merck executive and now being with Premier, do you have any advice for companies on this?
Absolutely. I agree with everything Greg just said, that fine balance that you're always trying to find. I think the best advice I can offer, and this is from both experiences, both in industry and also at Premier on behalf of our members, is really doing that environmental scan. So we've spent a lot of time today talking about all of the challenges that hospital systems are facing, what's going on from a political environment, the threats, the opportunities. Knowing all of that is true is really helpful. And then taking that to the next step to think about how you can do some demand creation for us is great. So solving our problem is perfect. I mean, that'll be great. We'll all be really happy when you solve our problem. But if you help us solve a problem we don't even know we have, that's even beyond perfect, if that's possible. So if you can tell me something that I don't know, but I need to know, then that's going to really differentiate you. And so I think the more that you can do to train your organizations to think in that way, to think about what are the problems that I might not even be aware of, but I'm going to be in agreement when you bring them to me, that's going to put you at a different level than any of your competitors, because everybody's trying to solve our problems, at least the ones we know we have, because we probably have articulated them to you, but it's the others that are really the next level.
Thank you, Mila. Good points there. Alistair, I'm sure you've got some thoughts on this as well. Love to get your take on what you think organizations should do in terms of strategies and resources that they can offer to help their customers prepare for more value-based selling.
Yeah, no, it was mentioned really well by both Greg and Mila. I'll tell you, we have two problems from a vendor's perspective. One is the first sample to purchase, so from providing that first sample to finally when the folks finally purchase your product, that's your first issue because there's a sales cycle in there. The second is increasing penetration into the account once your product is on the shelf. That's a huge issue as well because adoption, physician alignment, and engagement, and standardization and protocols, all those things come into play. And that's a lot to unpack, really. So from the perspective of what you can do, to Mila's point in particular where she said, tell me something that I don't know. Education and development really for your sales force is key. You have to know how the market is shifting. It is complicated. It is complex. It rewards companies that take steps to really incorporate training and development plans to get their sales professionals prepared. So not just sales, but also in marketing, in commercial operations. So from a leadership perspective, all of those things are involved in the education and development because you really have to transform how you do business with providers today to help them meet their needs. The second thing I think in terms of the adoption piece, the second part of your selling, market segmentation and account targeting is huge. It is key. It is one of those things that can really ruin you. As you can see, this is going to increase your sales cycle if you're working with a strategic customer. It's long, it's hard. Implementation is even harder. You're talking anywhere from, in terms of some companies, anywhere from a 3-month to an 18-month sales cycle. So you can't afford to have 3 or 4 or 5 strategic customers. You need to pick the best one. You need to also have some transitional customers willing to experiment, and you need to have some of those transactional customers out there. They're still about 60-65% of the overall market. So really, remember to market segment and account target properly so that, one, you could keep the lights on, but two, you can also be working in accounts that are really going to help you hit your revenue goals. I like to say your strategic customers are the ones that are going to help you hit your revenue, as opposed to your transactional customers. The only way a business is going with a transactional customer is down, even if you have all of the market share. Their job is to get 10% out of your hide every single year. So it can only go flat to declining. Where you're going to get the biggest bang for your buck is in those strategic accounts. It's longer, it's harder, but it's doable. It starts with education, and it starts with market segmentation and account targeting.
Alistair, thank you. All right, so let's spend our remaining time talking about the role that training plays in all of this. You know, training, of course, is one of the key strategies that organizations can use to prepare their sales professionals for value-based selling. And I'm curious where the audience thinks sales teams have some room for improvement when it comes to value-based selling. So audience, can you please tell us which value-based selling competency needs the most development among sales teams in the industry? So pick A if you think sales teams need help with business acumen. Pick B if you believe sales teams could benefit from more training on teamwork and collaboration. Please pick C if you think they need more knowledge of the market landscape, or pick D if you think it's consensus selling, which requires getting buy-in from multiple stakeholders and influencers. Please go ahead and make your selection, and in a minute, we'll review the results.
Great. It looks like everybody is voting very quickly. Again, folks, if you could wrap up your choices in the next couple of seconds here, we'll close the poll and keep the program moving ahead. And once again, one of our audience members suggested an E, all of the above options, Laura.
We'll do that next time.
Yes. Thank you very much for your feedback there. Okay, but let me go ahead and close off the polling at this point. Thank you again for participating in our polls today. And Laura, here are the results.
Okay, all right. So the top one is knowledge. The greatest need is knowledge of the market landscape, which is interesting. And given that it's changing so much, I'm really not surprised. We also have 32% saying that the greatest need is around business acumen. Let's see, 15% say it's around consensus selling, and then about 9% for teamwork and collaboration. So maybe we're doing a little bit better with teamwork and collaboration. All right, so that's interesting. I'm wondering what the panel has to say about that. But let's go ahead and move on to the next slide, and maybe the panel can address that, and also talk about the role of training in helping to address some of these issues. Greg, can you talk about how your training program has evolved in response to value-based payment trends?
Yes, Laura, I'd like to reiterate the first part is that we've really spent more time on process than we have on conversations, even though I think both are important. But I remember a day where just, verbal sparring and conversation training was the kind of the thing of the day. And now it's more really about the process and helping understand the differentiation grid, pain chain, and all these other terms. How do we get committees to make decisions? But what's interesting, even though my job is to train a group of sellers to people like Mila and the people that she works with, I'm also a buyer, right? People come to me, and whether it's CMR or lots of other groups, I've watched my own buying change because the topics I have to train for are different. And I agree with both those answers there about business acumen and the whole marketplace. We kind of lump it into a topic, and we just call it HCE, healthcare economics. But we've learned we've had to get people more astute on the C-suite itself, but on healthcare economics. It's easy to throw around fee-for-service and value-based purchasing. Probably most of the people you work with or you're in charge of training would know about that. But when you start going another layer deeper and talk about ACOs and macro and the difference between triple aim and quadruple aim and who does it impact and how do you get the story and how do you use definitive healthcare data, Laura, we're having to train on all those things now. Pulling hospital data, private data, public data. How do we get a hold of as much as we can so that we can, like Mila talked about, how do we tell them and call to mind pains that they didn't even know they had pains on? And that's been our strategy, is to help people become more the people that are teaching the hospital and teaching the customer, and then that usually brings about good communication, makes us a partner.
Thanks, Greg. Now, let me check in with the other panelists. I'd like to know their thoughts about how training can be improved to better meet the needs of customers as they're moving toward value-based payment models. Mila, can you maybe start us off with that? Any thoughts on training?
Yeah, so I'm not surprised to see that knowledge of market landscape is the highest area where people feel like training is needed. And it is a moving target. I think that you already said that, Laura, but I also think it's kind of to the point that Greg just made, that there's all this data in these places where you're getting insights and intel, but it's only as good as the source, and it's updated only at certain intervals. So my recommendation would be, as often as possible, bring us in, and I'm using us collectively. So whether that's an actual physician or a CMO or a pop health leader or somebody from a GPO, whoever you think can really give you that up-to-date current information like we're doing on today's webinar, we really should be part of your training, because you're not having to wait for an organization to come poll us for information, then publish it, then you have to try to dig through it and see what it means if we're even using the same nomenclature. You instead can hear directly from us, just like we're doing today. And there are very good manufacturers and suppliers that do bring us in, where we come in and speak to them at sales meetings, or some of our members do the same. We also have, as you know, a lot of conferences out there like IDN Summit and others, where there are abilities to hear from the GPOs and the providers directly. And I think that's really the way you're going to get the most current insights and intel.
Thank you, Mila. Alistair, what about you? Any thoughts to add?
Yeah, absolutely. You know, obviously I'm biased because I consult for CMR, but I really like Mila's point about that up-to-date information because, again, the landscape changes literally by the day, and you really want to be up-to-date on that. There are many companies thinking about how to address the new value-based model. And the problem, right, and this is what we want to try to avoid, is if they don't see everything all together, the strategy, the training, the timelines, and all that, they don't move at all. They don't do anything. But I got to tell you, to be successful in the new healthcare environment, you really have to have the ability to see some opportunities in all of this change that's taking place. So right now, most people see it as just a problem or an issue. So as a company, knowing the market, understanding your customers, their challenges, what else is coming is really important as well. Because to Mila's point, it's changing and it's affecting their bottom line. So what's coming? What do you need to be prepared for, and how do you need to address that? From a rep's perspective, start with simple stuff. Just take a step, segment your account, segment your territory into, again, those strategic, those transitional, and those transactional customers. Get a mixed bag. Start to diversify your portfolio. I remember being a sales rep, and I remember making my targets, hitting my revenue targets, and also winning Rep of the Year on 7 accounts, and that's all I would go to. But then the very next year, I'd be at the bottom of the pack. So you got to really figure out, how do I grow my market for the next year? It's only going to come from that strategy, and understanding how to deal with D and C level executives is really key to that. So education, strength, markets, account segmentation, and account targeting is key. But really, take a step, do something, because there are a lot of folks out there who aren't doing anything at all, because it all has to be all packaged into one thing for them to see it.
Alistair, thank you. Appreciate that. So we've got about 10 minutes now. Why don't we go ahead and open up the discussion and take some questions from the audience. Tim, why don't you take it over from here?
Thanks, Laura, and thanks everybody on the panel. Great presentation and discussion today. Greg, I'm going to start with a question of Christopher sent in for Greg. Greg, what route did you take to train differently relative to what you mentioned? Were vendors involved, or did your training team develop content internally?
I would say it's both. We've used vendors. I've used outside physicians or even C-suite and brought them in, and I've hired trainers that are dedicated toward this topic. Instead of everybody being product related, then we have had people that are titled Healthcare Economics Director of Training. And that's how we've been able to do it. It's just it's a combination. We could not do it without outside vendors, especially like for e-learning that's already off the shelf. We don't have to prepare all of it. But having said that, we couldn't do it without dedicated internal resources as well.
Nice, thank you. Well, and speaking of internal resources, and I'll open this up to whoever on the panel wants to jump in on this, a question from David. Is it more effective to train an existing sales force to transition to value-based selling, or is it better to hire a new profile of representative with separate competencies?
Hey, if you guys wouldn't mind, I could jump in on that. That's a really, really good question, and I think that's sort of the mental hockey that we play in our minds across the industry on a daily basis. Here's what we really have to remember, and I think this kind of answers the question. What we have to remember is this is all new. So even if you go searching for that person or persons out there that have this expertise, you're going to be really limited in your scope. It's important to start to develop your folks in that particular area, because if you're just looking to go out and hire to these competencies, it is going to be a long, long day. But if you can stratify and within your own organization, find out the folks that, if you just do some stack ranking and start to find out which folks on your teams first are having the most issues across the country. Where are they across the country with value-based payment models, and how is it being implemented in their regions? What's their capacity to be able to do this? And start to develop them. I think you're going to find the most success for that. So it's probably a little bit of both, right? Again, a little bit of mental hockey. Trying to find someone is great, but at the same time, developing your people, taking them to the next level, elevating them is really important, because on both sides, both on the provider and on the supplier side, we don't necessarily have all the expertise that we need to be able to answer all these questions. So development is key.
Excellent. Thank you, Alistair. Good answer. Milo, let me throw this one to you. Which programs and resources tend to be the most attractive to customers engaged in value-based payment models?
So I think it goes back to the ones that are most aligned to the biggest problems that a system's trying to solve, as well as that are simple enough to execute. So I mentioned earlier that we are venturing into value-based contracting, where we're saying all these value-based payments need to turn into something contractual. And we'll have ones come to us that would solve a problem in a very important way, but they're so complex and hard to follow that we're confident that our member hospitals could not operationalize them. So I think we've spent a good amount of time talking about, figure out the problems that they know or they don't know they have. But then when you come with the solution, it needs to be something that we understand how to implement and that will be successful. And it's really not good for you, us, the patients, anyone involved, if we can't operationalize it, even if it was a great idea. So I think making it not just easy to understand, but easy to do is really important.
Thank you very much. We have a follow-up question from Laura, a follow-up to Laura's previous question. I'm sorry. On a similar level to the question that was already presented, how important is a master's in public health or other advanced degrees or even PhDs to be able to effectively implement a value-based model?
Alistair, do you want to take that one for us?
Sure. So obviously, you guys see my title. I have a master's in health administration, and I can tell you that it has helped me immensely. A lot of folks think that the Affordable Care Act was written over a weekend. No possible way they could do that. 2,500 pages over a weekend. So throughout my master's program, we spent a lot of time working, going through Hillary Care, which was the first iteration of this, going through value-based payment models, because this transition has been taking place for many years. It's just now being implemented. So I can tell you from that perspective, public health, health administration, it really does get to understanding value-based pay, value-based care, alternative payment models. It really gives you a deep understanding of the situation and how it affects the marketplace. Really what it's trying to do is help you understand that this is an economic problem for the country, not necessarily just a payment problem or just a healthcare problem. Really, it's an economic problem, an economic challenge for the country. And once you boil it down to that, you start to understand really the framework for putting this all together and having a vested interest in making it work. So I'll finally say that a lot of folks think that this is going to go away if we just get the right president or the right administrators in place, and we'll just sign this all away. It'll all go away. Value is starting to show some effect. I think you saw from the first couple of slides that there are a lot of folks out there, administrators, who are saying that they're getting some positive payments and positive effects out of this. I can tell you that the train has left the building. It's not coming back. So it's really important to be as armed as possible with all the information about how this works, how it affects your business, and what you can do about it.
Excellent. Thank you.
Tim, this is Greg. Can I jump in on that one?
Please do.
I'm cool with that degree, and it'd be nice to have that on the staff or have it within the company. But equally important would be the experience of people that have sold at the C-suite and service line level. Is that teaching people not just what the policy is, but how this works and examples of why this is important to certain customers and how they react to certain policies, and just the experience of selling at that level. I find that to be very important, but I'm biased since I run sales training. So both are important to me.
And Greg, let me ask, while I've got you on the floor here, let me ask you a question for you, and Milo might want to jump in on this one as well. Who are the call points and partnerships needed for value-based selling?
We have learned that it's higher the better. That to the decision makers. Let's assume it's just a regular hospital to start. You can't alienate procurement, materials management. That's just not the real world. They could cut you off at the knees, Tim, before you come in there. So you gotta play ball there. You gotta know the different departments and the decision makers, the service line if that person exists, and then of course up into the C level. And that would be just that for a regular hospital. So this whole consensus selling, which I saw was one of the options on an earlier question. But then I would go on to say, now if it's an IDN, which is where a huge percentage of all medical device sales go to, are to IDNs. They control, I don't know, anywhere from 70, 80% of all business or more. Is that now you have another level or two that you have to get up there. So finding, Tim, the exact decision makers and influencers, that seems to be the key. And it's an easy thing to say on a conference call, really hard to do in real life.
So what I'll add, I agree with all of that. I mean, there are so many multiple points. One of the things that I have noticed more and more, and especially now that I engage with manufacturers and suppliers on a regular basis, is that almost every organization has a role that's trying to meet with the C-suite. So if you think about how many organizations that are out there trying to meet with the C-suite, and then of course there's other people that have nothing to do with industry that also need to meet with the C-suite, and then there's things that they need to do every day because they work in the C-suite, it's really going to be logistically impossible for everyone to meet with the C-suite. So I think it's also important to look at organizations and really understand those where that's necessary and those where it actually isn't. And in fact, there really is that sweet spot between meeting with them and actually doing some work with the organization first. So you may find that you really have to straddle that line of meeting with people in a tactical way so that you have examples that matter to the C-suite, so that when you get that precious time with them, it's really impactful and valuable and it's tangible to them, and that they're going to want to meet with you again when it's appropriate. Because at the end of the day, we can't all meet with the C-suite. That just isn't going to happen. So what are some other ways to get that done? I think the second thing I'll point out too is a lot of times your call points are actually in points of contention with each other. And I don't mean they don't get along, but what I mean is if you're looking at the incentives and goals for your supply chain executives, they really have cost goals. And then if you contrast that with the incentive and goals of your pop health and ACO leaders, they have quality goals. Now, if you can get both of them at the table, you're going to have the best conversation you've ever had, because they're going to get what needs to be done for their healthcare system to be successful. But if you're talking to each separately, it's going to sometimes be hard to continue and put forth some of the initiatives that you want to do.
Excellent. Thank you. Great answers on that one. It looks like we might have time for one last question. Let me make it this one from Troy. How are companies keeping their sales teams informed of the changing landscape so they can adapt their value propositions accordingly?
That's a great question, if you don't mind me jumping in. So we were able to do a study, if you will, at last year's IDN Summit. We just asked some questions and polled the audience. And it was a really good mixed bag of folks that were in the room, from top-level executives within the organization to corporate account directors to sales representatives. And what we found, by and large, was not much. that not much is happening, not a lot is happening across the industry. And that's, I know I'm painting with the broad brush, but the question was asked in sort of a broad stroke. There's a lot more that can be done. And again, it feels like a lot of folks are a little bit afraid to make that first step, but doing something really is important. Whether it be just getting folks up to speed, just giving them the business acumen they need to get that credibility to, as Mila say, get that C-suite conversation going. When you get it, and you will at some point get that conversation. And when you sit down, you really want to have a credible story to present to these folks. So that's what I can tell you in terms of the polling that we've done. There's not a lot going on. There's a lot of talk about it, a lot of thought about it, a lot of trialing different ways that we could have the sales force show up. But in terms of movement, that part is the part that needs to pick up a little bit.
Excellent. Thank you, Alistair. Well, it looks like we're at the bottom of the hour, folks. I'm going to go ahead and have to close off Q&A here. I know people have next appointments to get to. If we did not get to your question, anybody in the audience, if we did not get to your question, we will try to get an answer for you offline as well. And certainly, let me also point out that CMR has been kind enough to share their information here. And certainly, I'm sure they'd be glad to hear from you offline, too, with any additional questions about today's topic. So with all that said, let me quickly thank our panel and our speakers today. Greg Adamson, Mila Maloney, Alistair Barrow, and Laura Ramos-Haguar. Very nice job, all four of you. Thank you so much for joining us today and for putting all this program together. I also want to thank our sponsor today, CMR Institute. Oh, thank you. And our sponsor today, CMR Institute. It was great to work with you on today's topic. And again, a really, really nice job on today's webinar, everybody involved. And that includes the audience. Thank you all for participating, for asking some great questions, participating along the way. I thought today was a really, really good webinar, and I hope everybody enjoyed it as well. Now, with all that said, let me just end with some little housekeeping notes here. I wanted to share with you some information on the 47th LTED Annual Conference. CMR is going to be there, and some many other folks. June 11th to 14th in Phoenix, Arizona. We hope you're able to join us. We've got more than 900. We're expecting more than 900 people like you at the conference. More than 70 workshops, 80 top suppliers, including CMR, a bunch of people. It's going to be a great show. If you've not been to one of these conferences, it really is the event to check out. You can find out more information through the L10 website. I'll also leave this here quickly, some L10 calendar events, some upcoming events. You can find out, again, you can find out more information about any of these programs through the L10 website. And I'm going to end with a quick invitation to have you join us for our next program on May 11th. We'll be talking about measurement can be dangerous if there are no results. That program will take place again on May 11th, starting at 12:30 Eastern. You can find out more information or register at l-10.org/webinars. Just as we follow up today, remember we're going to send you an email about 1 hour with a link to today's webinar recording. It'll be posted even sooner than that to l-10.org/webinars on demand. You'll be able to check back at your convenience on that recording. If you wanted to hear anything over or share with a colleague, certainly feel free to do that. And finally, my information is here at the bottom of the screen again. If I can help you with anything around today's webinar or any of our other programs, never hesitate to reach out. With all that said, I'm going to send a final thank you again to our sponsor, CMR Institute, and to our speakers, Greg Adamson, Mila Maloney, Alistair Barrow, and Laura Haguar, and again to the audience. So thank you all for joining us. We look forward to seeing you back here for the next webinar. Have a good rest of your day, a good rest of your week, and we'll talk to you soon, everybody. Bye-bye.